Paris, the year 1811. Imagine you are in a bedroom. There is no modern, sterile operating room. There is no beeping sound of a heart rate monitor. There are no breathing tubes. There is no ether gas. The female writer, Fanny Burney, lies down on her bed for the doctors to perform a surgery to remove a malignant tumor. She is not put into a peaceful sleep. And she knows exactly what terrifying thing is about to happen to her body. The table is full of cold steel tools, the cloth towels, and the hand of the surgeon begins to swing the knife. Throughout that entire process, she is completely awake. The year 1811. Surgery still took place in such a bloody and painful manner. But wait. If 35 years before the anesthesia revolution, surgery was still that terrifying, then how did humans dissect each other throughout the thousands of years before that? How could a surgery be successful when the patient felt every single cut? To understand this, we must shatter a classic myth. Many people think that before modern anesthesia was born, doctors simply gave patients alcohol to drink, made them bite down hard on a piece of wood, and started cutting. The truth is much more complex than that. Ancient surgeons did not lack ideas about pain relief at all. They experimented with opium, mandrake, henbane, alcohol, chilling the body, tightly compressing nerves, and ritual practices to distract attention. The core problem did not lie in them not having discovered pain-relieving substances. The problem was they did not have a reliable way to control them. The boundary between a dosage that makes a person unconscious enough to endure a knife cut and a dosage that makes them stop breathing forever is an invisible and extremely fragile boundary. Without monitoring machines, turning a sedative drug into a surgical anesthesia method was truly a life-and-death gamble. And so, before inhalational anesthesia was born, surgery was not about waiting for anesthetics. It was a grim art discipline aimed at helping patients survive through three limits at the same time. Those are pain, blood loss, and infection. Pain demands extremely lightning-fast speed. Blood loss limits the depth of the blade, and infection can cause a surgery considered a brilliant success to still end with a painful death many days later. As early as 31,000 years ago in Borneo, archaeologists found a skeleton missing its lower limb. Bone traces show that this individual lived for an additional 6 to 9 years. The scientific community was once shocked to consider this the earliest amputation surgery. However, some orthopedic trauma doctors counter-argued that it might just be a severe open fracture injury leading to the loss of the lower limb. Even the most ancient surgery of humanity comes with fiery debates. But when civilizations rose, surgery was no longer random. It had rules. The Code of Hammurabi of Mesopotamia clearly regulated that if a surgeon used an operating knife and saved the patient, they would be paid a large sum of money. But if the surgery failed and the patient died, they would have to face incredibly brutal legal punishments. Moving to ancient Egypt, the Edwin Smith papyrus scroll shows us another truth. The best surgeon was not necessarily the person willing to cut the most. The scroll recorded in detail how to examine, diagnose, prognosticate, splint bones, and suture wounds. The first lesson of ancient medicine is exactly that. Surgery was largely about stabilizing the body so it could heal itself, not always about swinging the knife. However, there were diseases that forced the blade to enter the body, and this is when the pain reached its peak. In the 1st century, the Roman scholar Celsus described in detail the bladder stone removal surgery. The patient was held down tightly. The doctor used his hands to locate the stone, pushed it down to the perineum area, made an incision, and used a specialized scoop to hook the stone out. Imagine digging a stone out of the body when you are still awake enough to scream, tense up every muscle bundle, and struggle. That is the reason why the assistants holding the patient down were not barbarians. They were an indispensable part of the surgical mechanism, aimed at keeping a body writhing in pain from having the fateful blade pierce in the wrong direction. Celsus wrote that an ideal surgeon is a person with steady hands and an iron spirit, who never lets the screams of the patient make them rush or operate incorrectly. In India, the Sushruta medical tradition turned surgery into a systematic craft, with incision, drainage, foreign body removal, wound suturing, and reconstructive surgery operations. Many people often assign the entire manuscript the timeline of 600 years before Christ. But the truth is, oral history is very complex, and the oldest manuscript currently dated with certainty only lies in the year 878. And this is the moment we arrive at the most shocking historical reversal. Did ancient people actually know how to paralyze patients, or not? Chinese history books mention a lot about the famous doctor Hua Tuo around the end of the Eastern Han Dynasty. Legend has it that he used a drug called mephisin to make patients unconscious before operating. But the original formula of mephisin was completely lost. Centuries passed by. Historians could only be skeptical. Did ancient texts exaggerate the truth or not? Until the year 2026, researchers analyzed the metal scissors and tweezers excavated from the tomb of the Ming Dynasty doctor Sha Quan, who died in the year 1411. And they found something extremely rare: chemical traces still clinging tightly to the surgical instruments. Spectral analysis confirmed the presence of compounds from the aconitum plant, an extremely poisonous plant. The distribution of these substances on the cutting surfaces of the instruments makes scientists believe that this is exactly the direct physical evidence showing that Ming Dynasty doctors actually used a liquid soaked in local anesthetic drugs during surgery. For the first time, we do not just read about a pain-relieving drug in old book pages. We have actually found its chemical remains on the blade itself. Of course, this proves the use of local anesthetics, but it does not mean that they invented the general anesthesia machine. Moving to the medieval Islamic world, the scholar al-Zahrawi drew a series of extremely sophisticated specialized tools. Meanwhile, other documents recorded the use of a sponge soaked in opium and mandrake to induce sleep. But once again, what the depth of that sleep was and how safe it was remains a mystery that cannot be determined accurately. But if you think removing a stone or cutting a surface tumor was already a torture, then look at the surgery that seems to hold the most certain death. That is trepanation. In the Andes Mountains, drilling a hole through the skull bone was an incredibly common practice. Prehistoric doctors would slowly scrape or carve a bone groove until the fractured part of the skull could be taken out, being careful not to puncture the meninges. It sounds like a death sentence, but archaeological evidence reveals a mind-blowing truth. In the Cusco region of Peru, a study on 66 individuals with 109 trepanation holes showed 83% of the surgeries left traces of strong bone regeneration. That means they survived. In some later archaeological samples, the survivor rate could reach up to 91%. Of course, this is not the success rate of a modern hospital. This is a rate inferred from bone healing signs, but it proves a massive shock. A hole in the skull does not automatically equal death. The surgery that looks the most impossible to us is exactly the surgery where archaeology can measure the survival rate most clearly. Arriving in the 16th century on the bloody European battlefields, artillery shells and swords tore apart the limbs of soldiers. There were no anesthetics. The surgeon had to make a lightning-fast decision: save that leg, or amputate it. Ambroise Paré, a great military surgeon, changed history. Before his time, after sawing off a leg, the doctor would use a red-hot iron bar pressed straight into the stump to burn the flesh tissue to stop the bleeding. Paré rejected that horrifying method. He promoted the use of thread to ligate major blood vessels. Paré did not solve the pain of the patient. He only solved one corner in the triangle of death. That is, keeping the patient from bleeding to death. So what about the infection corner? What did ancient people do when they did not know what bacteria were at all? They washed wounds, drained pus, removed foreign bodies, bandaged with honey, used vinegar and alcohol. They could realize that a clean, well-drained wound would heal faster than a wound filled with necrotic flesh. They had incredibly excellent empirical wound care skills, even though they were completely unaware of the germ theory of modern medicine. Humanity continuously got very close to the boundary of painless surgery, but continuously failed to turn that idea into a reliable system. In the year 1784, Dr. James Moore tested a device that tightly compressed nerves to paralyze the arm. That technique did work in some surgeries, but it was too difficult to control and never became the standard. And so, we return to the year 1811. Fanny Burney still had to grit her teeth to endure the flesh-cutting blade in a completely awake state. It was not until the mid-840s that inhalational anesthesia officially crossed the threshold of history. It was not just a herb. It was not an intoxication. It was a stably repeatable procedure capable of making patients sink into nothingness for doctors to operate. The birth of anesthesia did not immediately make surgery absolutely safe. Blood loss and infection were still there, but it changed a life and death question. Before there was anesthesia, doctors always asked themselves, can I complete this before the pain, the struggling, and the blood loss make it become impossible or not? And after there was anesthesia, the new question was, how deep can I cut? Before the era of anesthesia, the most astonishing thing was not that ancient people endured pain better than us. Their nerves were exactly as sensitive as ours are now. The most miraculous thing is that surgeons learned how to work inside a suffocatingly narrow gap between pain, blood loss, and infection. And by a miracle of primitive medical art, some of their patients still survived. The birth of anesthesia did not teach humans how to hold a scalpel. It simply handed surgeons an ultimate weapon that they had never had throughout the past thousands of years. That is exactly time.